So, are silver fillings bad for you? Well, here's the truth about silver fillings. Silver fillings are an amalgamation or mixture of a bunch of different metals. We have silver, tin, copper, and as you know, the dreaded mercury. Usually, they are very stable. You do not need to take them out for many, many years. I myself actually have about, I think, three small silver fillings left in my own mouth. The problem is when they start to corrode, when they start to chip, when they start to crack. You can see here the edges of this filling, silver filling, is cracking, right? They're corrode, they're metal, so they're actually going to break down. So what's going to happen is now bacteria is leaking underneath those silver fillings and cause cavity. Most of the time when I remove these silver fillings, there are two things that I find. Number one, cavity. There are almost always cavity under them. And number two, there are microfractures or breakage under them. The reason is because they don't support the actual teeth too well when they're too big. So if you start seeing chip or breakage or corrosion around the edges, definitely get them checked out and removed. When we remove them, we do need to remove them properly. Usually we need some barrier, some isolation called rubber dam, and some high-speed vacuum or evacuation to make sure that when we grind these metal bits and pieces, the patient don't swallow them, but also we're not breathing in that dust. Right? These days, the filling of choice, or the material of choice we use to do a filling is called a resin composite. They're white, they're tooth color, they have different shades that we can choose from, but that's the material of choice these days. I haven't placed a silver filling in, I guess, 14, 15 years now. So they're not common at all these days. So if you have one, get it checked out, make sure that they're doing fine. If they're not, have your dentist remove the silver fillings properly